I'm at the reception desk in the doctor's office. All of a sudden, everything's getting blurry, and the next thing I know, I'm on the floor looking up into Dr. Deas' eyes.
We had a patient that came in for an appointment. They hadn't been in our office for almost 4 years, so we didn't have a paper record on the chart because it was archived. We didn't have any other paper records that had been sent over in advance, and as the patient was checking in at the desk for that appointment, became lightheaded, started to faint. Some of our staff recognized this and assisted him and just laid him down on the floor before he passed out.
I'm really starting to panic. Here I am, lying on the floor, looking up at Dr. Deas. He hasn't seen me for 4 years, and how is he going to know anything about me?
But I opened our electronic medical record, and in there was a continuity of care record from SandlotConnect that included quite a wealth of information. He had been in the hospital just a few weeks before at one of our participating hospitals. We had a list of diagnoses, all of his problems, medications, allergies, the names of his physicians, and a host of laboratory tests that had been done, blood counts and chemistries, x-ray results, that kind of thing. That was profoundly helpful in figuring out what was going on.
And I'm shocked. He really knows everything about me. He's got his computer screen up, and on there's the information about my diabetes, the information about my heart condition, the recent visit to the hospital. He's got all my meds there.
Having that information right there at the time of service and right there at the place of service allowed us to make decisions then that may have been delayed had we had to request paper records, or had we had no other records, he would have very likely been transferred by ambulance to an emergency room for an evaluation, because then you have to consider a lot of other events, heart attacks and strokes and that kind of thing. But knowing what we knew, we decided we would provide him some IV fluids for dehydration. We'd check his blood sugar and make any adjustments to that we needed to, and that resulted in a very prompt improvement in his symptoms.
One of the problems is also the diuretic I've been taking, so he's going to take me off of that prescription.
Without the records that we had immediately available from SandlotConnect, you're essentially working in a void. And so you have to assume the worst. And in many cases that means calling an ambulance, going to the emergency room, sort of a panic response rather than a controlled, managed response, knowing the information that you had.
The doctor writes me a prescription right there and then. He puts it into his system directly to my pharmacy from his office, so my nephew and I are able to pick it up on our way home.
The advantage to this patient of something like SandlotConnect is that all of his providers have access to the same information, whether you're a gastroenterologist like me, or a cardiologist, or the primary care physician, or the hospitalist, or the emergency room physician. All of those people can, at a second's notice, get all of that information on diagnoses, problems, medications, allergies, recent visits, who the other doctors are. It's absolutely essential for the coordination of complex disease systems to be able to manage with that information and know who you're working with.
As I look back, I'm very grateful that the doctor had all the information about me right then and there in his office. Otherwise, it would have been an ambulance ride to the hospital, a series of tests that I had already had before. They would have been looking at the heart issues as well as the diabetes issues, and it would be a lot more bills, and I'm still paying off the ones I had from the last time in the hospital.